So you can't have a lifetime limit on a benefit, you can't have an annual limit on the plan. So before, if we had a $2 million or $5 million annual maximum, the benefit is now unlimited. No pre-existing condition limitations, so if someone were to come to the district, start working here, be offered insurance, that you don't have to ask them for a HIPAA certificate anymore, they can get on the plan, no pre-existing condition limitations can apply. And then there needs to be coverage of certain treatment related to clinical trials. So in the past, if someone was in a cancer clinical trial, the plan could avoid paying any of those costs whatsoever. Now you do have to pay the routine costs that would be associated with those.
Only routine costs.
But anything you would have normally paid underneath your plan. So you're not picking up the full cost of the clinical trial, but there are specific pieces that you will be required to pay for at this time. And it's hard to get into a clinical trial. I will say that, you'll see later on, neoplasms cancer is a big driver of healthcare costs here at the district. So you could get one person, but it might just be one person, just based on your population.
Now, in the past, we never had, any employee we had hired, even if they had a pre-existing condition, we covered them, right, or not?
That changed a couple of years ago. Before then, if somebody, a brand new employee could get on the plan, but anybody else coming on the plan after their initial date of hire would have to go through, like an evidence of insurability or be subject to pre-existing conditions. So the district, that changed a couple of years ago.
Lisa, could you back up the PCORI fees? Did you say?
Clip4 fee? I'm sorry?
$2 per day?
$2 per person per year.
Oh, okay.
Yeah. So that one's inexpensive compared to the others. $3,300.
What's our catastrophic limit? Is it $2 million?
There is no limit on the. Are you talking? Okay. So on the plan is self-funded. So that means that you pay Blue Cross for administrative services. You pay them to administer your plan. They also provide what's called stop-loss insurance. So I believe we're at $125 for large claims. So anything above $125,000 for a specific individual is picked up by Blue Cross. Then you also have an umbrella policy over the plan at 125% of expected claims. So you have two areas of protection from Blue Cross that you pay for. So as far as the plan, if somebody were to be very sick, there's no limitation on benefits. If it was $10 million, the district would pay $10 million in order for Blue Cross.
Now, do you have any idea what those two umbrellas cost, stopgap and umbrella?
Yes, but I didn't read it. Yeah, it was part of the renewal paperwork. So if we go back to the presentation I made to the board for your renewal, there's a line item for each
So
one.
is it normally something like 10,000 or?
Much more.
Okay.
Yeah, much more. But it's been quite a return on investment here for the district because in the past you've had significant large claims. So you usually make out on
And
that
of
deal.
course, the next year, they take care of that with the reissued premium.
Well, what they do, what Blue Cross does with their stop loss, they don't necessarily look at you as an individual client and where your experience is. They kind of put it together as far as an overall book of business. So that really helped you this year because if you were not with them and subject to a different stop loss carrier, it could be different. But the stop loss carriers never get a one-for-one return. It's always, they're betting that they're going to make out on the deal. Sometimes you do, sometimes they do. But in the long run, they still will make more money. But you have the protection.
And I'm sorry.